So 1 in 8 women will be diagnosed with breast cancer by the time they turn the age of 80. Here to tell us a little bit more about that is Heather from Coastal Family Health Center. Thanks for being here.
You're welcome, Chet. Thank you for having me. And you're absolutely right. Once women hit age 80, 1 in 8 can be diagnosed with breast cancer because your number one risk is being a woman. Your second risk factor is age.
And so this is, how common is it that when women come in to be scanned, it's a small tumor, it's a small mass, or something that's easy, as opposed to it's stage 3 or stage 4?
So mammograms can catch breast cancer before it can be felt. That's why it's important to do the screening. Usually I'd say about 10% of women may get called back on their screening mammogram for further workup.
So you're telling me there's a very high percentage of success against this form of cancer, but it all ties into 3 main components.
That is correct. Your 3 components to good breast health. 1 is your self-exam, once a month. 2 is your clinical breast exam with your clinician once a year. Your 3rd is your screening mammogram. Because when you come every year, it's a gift. You find out there's nothing to worry about, or you catch something early.
So when you talk about a self-exam, how do you explain to someone how to do that?
Well, fortunately, I don't have to. I can show them with I have like a little flyer I give them. Because that is a very common question. What do I do? When do I do it? And since I don't just take off clothes and demonstrate, I will give that to them. But it's very detailed, how to do it, when to do it, and why to do it.
And so you mentioned that it's a gift, right? So kind of dive into a little bit of that. So when you come in and I guess it's telling someone that they don't have breast cancer is really what the goal is. But when they have it, what are the next steps?
So after a biopsy is done and it's read by a pathologist that comes back cancer or not, that is the decision between the patient and their doctor. Some, of course, go straight on to oncologists. Some do just a lumpectomy where they take out part of it. Some remove the whole breast. There's a lot of different factors of why they would do one thing over another.
You may have some individuals who are, fearful of that exam. There's, maybe it's invasive, maybe it's not. Can you explain us what the exam process looks like?
I sure can. I can tell you right now that mammograms are still the best way of detecting breast cancer. And they're not invasive. They are uncomfortable, a little awkward, but the pain is very minimal unless you have any. You may not even have any at all.
So whenever you come in and it's time for that exam, what happens when you get here? What does the exam look like itself?
So first thing we do is we have the patient fill out a history form to make sure nothing's changed, that maybe their family history of breast cancer, what's going on with their health, their breast health. And I go over that with them. And then we have them change in a little private area. And then it's only me, the tech, and the patient in the room. Door's locked. And it takes about 10 to 12 minutes to do an exam. I take a couple of pictures of each breast. They have to hold their breath for a few seconds, and then they're on their way. But after, I do have to get it read by a radiologist, and I send every patient. At this point, I'm sending written letters. I'm sure eventually we'll all go to email or text message, but right now it's still written letters.
And so, once you get here, you've had the exam, you've sent it off. What does the time frame look like for someone who's kind of, you're just waiting. You're just waiting for that answer. And that can be one of the more stressful times, because what if you have family members who have had this before?
Absolutely. I gauge my patients. If they're overly stressed out, I'll call them with results, because that's just the way some people are. Most are not too bad, and it may be up to a week, depending on where they live, to get their results by mail.
Yeah, so we're not talking about a long time.
No, and sometimes our providers, I know here at Coastal, contact the patient before they even get my letter.
So if you are one of those individuals who gets that message or those results back that yes, you have a lump, and what are the processes? Is this typically a chemotherapy kind of treatment? Is it radiation, or does that depend on the stage?
Not yet. Okay, so if you have your screening mammogram and our radiologist sees something on there, you go and you have a diagnostic mammogram or ultrasound too. Now, we don't do those here at Coastal. We send them off to facilities that have ultrasound and a radiologist on staff. And then they'll get the images of just the area they're looking at and the ultrasound, show it to the radiologist, and they'll find out right then and there what's going on.
And this is something that, every year in October we talk about, Breast Cancer Awareness Month, but this isn't something that you should really just be focusing on during 31 days out of the year.
Absolutely. For me, it's not 1 month, it's all year. So that's why I always advocate for women's health. If you're at 40, or if you have a family member that was way younger, you can start earlier. But most of the gauge is 40. American Cancer Society says come once a year, get your screening mammogram.
So
Please.
let's talk about women's health in general, because here at Coastal Family Health, you're doing more than mammogram work, right?
Well, correct. We have an entire women's health department in 2 of our facilities. Actually 3, if you count the one up north. So we are very dedicated to help our patients stay healthy, get healthy and stay healthy.
So for those women out there who haven't thought about this, other than just staying healthy, not getting a cold or having seasonal allergies and things like that, what should they be on the lookout for?
So, because my part, I do focus more on mammograms, and I'm so proud to work at a place that's able to offer that, because it's not something women want to do. They don't want to come see me, but they have to come here voluntarily, and our patients come here voluntarily to get it done. So it's so nice that Coastal is able to offer that, because it's more of a screening tool. It's not, I'm sick, what's going on? This is something women have to do on their own time, come in and get it done every year, and they're doing it. And they're coming back every year because we are out here advocating for women's health.
And it's very important, right? Because something that could be seen as something very insignificant or minuscule could turn into something much worse.
That is so true. I have unfortunately seen patients who waited years between mammograms, and that could have cost them their life. So that's why I say come every year.
And like I mentioned, with respect to women's health, what are some of the other women's health concerns that the staff here sees on a regular basis, or not even a regular, but just on a basis?
So women's health, of course, our women's health department, they see both the pregnant and then the not pregnant women. They do pap smears, they do biopsies. We do ultrasounds for women that have female problems, and that's all done in our Biloxi office.
So you're open. How many days a week are you in operation here?
We're Monday through Friday, 8 to 5.
So basically, do you have to schedule an appointment?
You do schedule an appointment with the Women's Health Department or with me to get the mammogram, but first you do see your provider, because the provider does write orders for the mammogram, because the report goes to them to make sure everything is taken care of.
And then you said real quick, we just have a couple seconds left, this isn't typically a clinic where folks who have insurance are going to go. This is a little bit of a different situation.
And that's why I'm so happy to be here with all the programs we have in here to take care of those patients. And we do it.
Perfect. Thank you very much.
You're welcome.
Absolutely.